Hi, I am Gitika Manandar and I am doing my project YouTube video PowerPoint presentation on understaffing of nurses in healthcare organizations. My purpose of doing this video project is to share the importance of adequate staffing based on the nurse to patient ratio, problem of understaffing and its causes, as well as provide external insight into health workplace. Importance of nursing policies and guidelines in order to provide safe patient care and minimize nursing error. At the same time, how a good nursing leadership enhance the working environment and reduce error, making workplace healthy and productive. Background issue of understaffing. Australian nurses are facing excessive workload due to understaffing because of insufficient graduate nurse, higher number of aging nurses retiring and cost minimization, which leads to issue with providing adequate care resulting to high risk of infection in patient, time management issue leading to medication error, falls and even death. Therefore, nurses' vigilance is essential at the bedside of the patient to provide and ensure patient safety, highlighting rationale to assign educate nurses with the ratio of the patient, which enhances the ability to provide safe care. Due to limited resources and time constraint, nurses are forced to spend less time with patient, which leads in different work-related issues such as burnout, unsafe practice, regular patient death, poor job performance, medication error, patient risk of infection, etc. At the same time, long hour shift and overtime leads to exhaustion, stress, mental issue, and nursing error. Study conducted in England and Germany shows the increase in medication error from 3.22% to 5.66% in 2006, reasoning understaffing. Thus, nurse leader plays fundamental role in educate staffing and managing stress level of staff by establishing nurse-driven staffing committee in decision making and planning. Be- Beside this, implementation of new budget plan for health sector and different act is being implemented in order to minimize understaffing and provide safe patient care. So, what is the problem? Australia, understaffing is one of the leading issues in healthcare organization due to lower or minimum budgeting of health and cost minimization. It directly or indirectly affects the health sector. Employment trend seems to be one of the problem of understaffing since large number of nurses choose to go part-time. According to a study, the number of part-time nurses increased from 41.2% to 44.2% between 1990 and 1999. So, greater number of nurses are required to provide same level of care. Other problems are recognized as aging of the workforce. According to Lippincott Nursing Education, with the study of around 1 million nurses are aged more than 50 and will reach retirement age in next 15 to 20 years, where rate of aging nurses who are retiring are higher than graduate nurse to occupy the vacant space. So, why is it a problem? Understaffing has become a problem because it generates error due to workload, which result in unsafe practice, stress, and burnout. It can also lead to lower moral absenteeism, patient risk of infection, trust issue, which evolves from lack of time and communication gap between patient and nurse. Understaffing also underlines the issue of health and associated infections as consequences of bad time management and adequate patient care, resulting in UTI, bloodstream infections, and cause of pneumonia. According to a study of more than 100,000 patients, where 6.2% of patients had day and night understaffing. As a result, patients were 15% more likely to develop care associated infection due to workload, time management, and stress, since nurses were not able to provide adequate patient care required by the consumer, which leads to trust issue, argument, and sometimes violence. Again, this issue addresses safe working environment and nurse safety issue. There is an evidence of the problem related to adequate staffing. That is, the patient mortality rate is lowered by 50% with inadequate staffing and increased by 10% if poor nurse work environment. And also, there is a decline in risk related to mortality in patient by 5 to 7% if there is 10% increase in proportion of bedside care nurse. What is currently being done? In order to provide adequate and minimum level of nurses and midwives to the ward, Victoria State Government Health and Human Service introduced the Safe Patient Care Nurse to Patient and Midwife to Patient Ratio Act 2015. For a safe patient care, the level of staffing is closely monitored by Deputy Director of Nurse and required to provide 6 monthly report to Nursing, Midwifery and AHP Board as per the rule of National Safe Staffing Reporting. According to Rounding Method Section 12 of the Principal Act, if the number of patients in the ward increases, to comply with the ratio, the hospital or department must ensure to assign with additional nurses. And according to NSW Government Health 2018, in order to minimize the issue of understaffing, the budget has issued $25 billion for total health where 1,370 extra health staff and $8.1 million in recruiting 80 new specialized nurses and midwives will be used. Furthermore, Australian government has also funded in education for nurses, so the number of student nurses increases as registered nurse in future to fulfill the demand. Leadership role in effective healthcare system. There is a moral and ethical duty of leadership in nursing which can be accomplished by motivating staff to accept change, provide adequate information, provide education and training about change and communicate about leaders' clear expectations. So, nurse leaders should assess the satisfaction level of staff in order to make any improvement. At the same time, patient satisfaction result is also equally important. By looking after adverse event, leader can assess any change after the change in ratio of staff and act accordingly. By embracing the change and providing encouragement and support to staff, leader nurse should always advocate on behalf of their nurse and patient, since change cannot be accepted without a supportive leader. Responsibility as a new graduate nurse. For a new graduate nurse, it is challenging and stressful to practice all the skills and they endeavor and deliver safe nursing care. So, firstly, it is important to understand the environment where the nurses will deliver care, which will help to analyze and plan accordingly for the shift. According to NMBA 2017 Registered Nurse Standard of Practice, Standard 6.1 to 6.6, it is stated that nurses should provide safe and quality practice and practice within their scope of practice, policy and guidelines in regards to clinical and non-clinical role. For example, checking age right before administering medication and doing second check with other registered nurse in order to deliver safe practice and patient safety. Knowing how to manage own level of stress is fundamental to keep new graduate nurse active and alert with safe and satisfactory patient care, whereas identifying different issues, advocating and escalating to responsible authority is one of the key responsibility of new graduate nurse. In conclusion, it is challenging for organizations to find groundbreaking solutions to improve health care quality. Legal Nursing Act and programs are being introduced and implemented by all the local government to enhance healthcare system in providing effective and safe patient care. Limitation in nurse-patient ratio and effective nursing leadership plays immense role in providing patient safety and satisfaction, decrease organization cost and make healthy workplace. With resilience programs, strategies to manage stress and extra time spent with patient helps decrease burnout, improve job satisfactions, decrease workload, stress, and finally decrease nursing error. This can be assessed by nurse leader with collective data and survey conducted with staff and consumers. While using motivational tools, nurse leaders should support and communicate effectively because change cannot be accepted without supporting leader.